Now, you would think if you went through surgery and had anesthesia, that numbing effect would keep your stress and cortisol levels low because your body wouldn't be able to feel the pain or injury. But that's not the case. When you go through surgery, you might not feel it, but your body is definitely going to feel it and react to it. There's all sorts of interesting research on the post-operative cognitive dysfunction that occurs after surgery. Now, there's a lot of post-operation symptoms in general or side effects that can occur that have nothing to do with cognitive, but we'll talk about that. What you need to know is that this effect correlates with the severity of your surgery. I had 2 major surgeries. Both were from a broken arm. I fractured my shoulder and I fractured my elbow in another accident. And that was actually a major surgery. I think it was like 3 hours. They had to put together my elbow with 30 different pieces with screws and things like that. And you can come out of it like you've been traumatized a second time. Of course, it was necessary, but there are some things that you need to know about and do to minimize the potential side effects from getting a surgery. Now, it really depends on how invasive the surgery is. But what happens when you go through surgery, you have to look at it like another trauma, a stress response. You're activating the adrenals, not just the outside of the adrenal, which is the cortisol response, but also the inside, the adrenaline. So you're gonna really raise your adrenaline and your sympathetic nervous system. And when you raise cortisol, okay, you can also lose your potassium. And this is why many times they will give you a potassium IV through surgery to make sure that your potassium doesn't drop down too far because it can affect the heart. Also, when cortisol increases, you get more gluconeogenesis, so your body is actually making more sugar. It's just like making more sugar, and it's going to affect your blood sugars. It can come down because then you spike insulin. And then you get sodium retention as well. So there's various things that can happen after surgery. It can affect your memory, your ability to learn, your inflammation levels, they can go up, your immune system. When you increase cortisol, your immune system actually gets suppressed. So this could leave you open to developing even an autoimmune disease if it's too much of a shock to the body. There's some interesting data, I'll put the link down below, of people developing Guillain-Barré syndrome after a surgery. This is an autoimmune disease. When you have high cortisol, you can also increase the catabolic effect on your body, where your body is breaking down more protein than it should. Muscle, hair, skin, joints. Also, there's some data on decreased wound healing after the surgery. Your overall mood goes down, like you might get depression or anxiety and have electrolyte imbalances. So what should you do if you know you're going into surgery and you can prepare for it? I highly recommend that you do intermittent fasting and then you fast the day before going in. What is that going to do? That is going to automatically strengthen your adrenals. It's going to give you some stress resistance. It'll increase your ability to deal with oxidative stress. It will increase your ability to make antioxidants and your recovery time as well. So you go through surgery, and then you do some fasting after the surgery too. That would be very, very beneficial. And then when you eat, make sure it's the healthy version of keto, because ketones in general are anti-inflammatory. And also your brain loves ketones. If given the choice, the brain will always pick ketones over glucose, and that automatically will help your mood. So doing healthy keto and intermittent fasting improves your cognitive function as well as your mood, as well as dropping inflammation and improving the immune system. You can even stimulate stem cells if you do periodic prolonged fasting. And lastly, if you're going into a surgery, I would make sure that you would take a good amount of electrolytes, maybe a few weeks or a week before you go through surgery and after you go through surgery, because of the stress response, depleting potassium. You want to keep that potassium in there, as well as other minerals. So the point about this video is just to increase your awareness of the connection between surgery and stress, and being aware that surgery is a major, major stress that can contribute to things. So you can now prepare for a surgery if you happen to have one coming up and minimize the damage control. And not to mention what they feed you at the hospital after the surgery. If you have to be in a hospital for a period of time, it's going to be refined carbohydrates. So I would do whatever I could to bring my own food or do fasting and not consume that hospital food. Thanks for watching. Before you go, if you have a question about a product, or you're new to keto and you want to know how to begin keto, or you're on keto and you need a debug because it's not going as smooth, I have a keto consultant standing by to help you. This is just for the people in the US. Hopefully in the future we'll be able to answer everyone's call, but I put the number down below so you can call and get some help.